am Dr. Magesh Balakrishnan, Interventional Cardiologist, Columbia Asia Hospital, Sarjapur Road. About 30 out of 100 people of our country are suffering from a silent killer disease. Yes, it is hypertension that I am talking about. Why am I saying it is silent? Because out of that 30, about 25 to 40% are aware that they are having hypertension, which means to say close to 60 to 80% of them are not even aware that they are having hypertension. And of the 20 to 45% who are aware, only about 10 to 20% are actually adequately treating themselves for the hypertension. Now, why is it a killer? Because hypertension leads on to heart attack, heart failure, stroke, damage to the kidney and the eyes, as well as the blood vessels to the limbs. Now, what is blood pressure and hypertension? Well, the pressure exerted by the column of blood in sideways against the wall of the blood vessel is called blood pressure. When the heart contracts, we all have an average BP of around 120, which is normal. But if it turns out to be more than 140, then we term it as systolic hypertension. Similarly, when the heart relaxes, the blood pressure normally is around 80, and if it is more than 90, then we call it diastolic hypertension. So in other words, for the normal population, blood pressure anywhere between 120 to 80 is normal, and if it exceeds 140 by 90, then we term it hypertension. Now, just as we age, our hair turns grey, in exactly the same way, the blood vessels of our body start to become stiffer, harder and thicker. That is responsible for the hypertension, and it contributes to more than 95% of the cause. This is what is called essential hypertension. A smaller percentage, about 5%, have what is called secondary hypertension, wherein there is a cause which causes it, as in it could be decreased blood supply to the kidneys, damage to the kidney itself, or it could be certain other conditions where there is excessive production of certain hormones which causes increased hypertension, blood pressure. Now, this set of patients are a little unique because they need a separate battery of tests to find the cause, and in some instances there can be permanent cure to their hypertension also. That is, they don't need any more medications for it.